getting you more this morning. Breast surgeon Dr. Elizabeth Arguelles from Southwest Florida Breast Surgery joins us live this morning. Now, she is getting us a little bit more on Breast Cancer Awareness Month. So good morning, doctor. Can you hear us okay here?
Yes, good morning.
Hey, and good morning. So I know we had a list of questions here, and the first thing we really wanted to start with is that breast cancer, very common in the United States. So are there certain things that can increase a woman's chances of maybe developing breast cancer?
Certainly, 1 in 8 women in her lifetime will develop breast cancer with no other risk factors. And we can't forget men. 1% of all breast cancers happen in men. So if you have a family history of breast cancer on your mom's side or your dad's side, not just of breast cancer, but could be of ovarian cancer, prostate cancer, pancreatic cancer, that could be significant as well. Other things that can increase your risk are being obese or sedentary, drinking excessive alcohol, or actually using postmenopausal hormones.
And I know that when people do self-exams, finding a lump can be very scary. However, not all lumps are cancerous, correct?
Correct. So a lot of times lumps in the breast are just cysts or fibroadenomas. It's definitely very important to report any new findings to your physician so that it can be checked with a mammogram or maybe an ultrasound. And then we can find cancer, if it is cancer, at its earliest stage when it's the most easy to treat.
In terms of treatment, we're talking about identifying breast cancer, of course, but also in terms of treatment, have there been any advances? Of course, we're in the year of 2020. Technology is evolving pretty much every day now. What's it kind of looking like in terms of, the treatment side? Because it can be scary, as I'm sure it is for many people, when, they might be diagnosed with something that has the word cancer in it.
For sure. Most people are very frightened when they come into the office, but they need to know that treatment has improved significantly. We now do different surgical techniques where we can actually keep the form of the breast looking very natural. We make the incisions around the areola, underneath the armpit, underneath the breast, so that when you heal, you don't really see the incisions. And we can use different surgical techniques like oncoplastic surgery to actually reshape the breast so that it keeps its natural form. Sometimes we can even do mastectomies where we keep the skin and the nipple in place, and we can do reconstruction so the breast looks almost the same as when you first were diagnosed. It looks like your natural breast.
And what are some of the warning signs that people can look out for?
Certainly, if you feel a lump in your breast, if you have retraction of the breast or dimpling of the skin, if you have any bloody discharge, if you have pain that is new or persistent that won't go away, anything that just doesn't feel right in your breast. It's so important to check your breast every month, and anything that changes, please report it to your doctor.
Of course, we are in Breast Cancer Awareness Month right now. So, I mean, it of course, is a month. I know that there are runs that are out there. Susan G. Komen, people are wearing, of course, the pink ribbons, and they're supporting breast cancer awareness. But, when this month comes around every year for you specifically, what does it kind of mean to you, to be in this field and also to be celebrating breast cancer awareness for an entire month?
It's just so fantastic because you get everyone working together for the same cause to really increase awareness. This is such a common disease that affects so many different people. It really touches everyone's life. And if you check yourself, if you go and get your screening mammograms, if you report your doctors, if we catch this disease early, it's so treatable. The 5-year survival for early stage breast cancer is nearly 99%. So it's something that while we can't prevent it necessarily yet, if we find it early, we can treat it. And it's just so empowering to see all the communities coming together to raise money, to raise awareness, to increase access so that people can really go out there, find teams that will take care of them, communicate with them, empower them in their decisions so that they can be treated individually and really have the best possible outcome for their cancer.
Yeah.
Well, Jessalyn and I want to thank you, Dr. Arguelles, for joining us this morning. And of course, you can get more information from Dr. Elizabeth Arguelles. That information is going to be located at her office. You see the phone number there, and then also a website that you can visit, the Florida Breast Surgery in Naples. Now, the website and number, again, listed right here on your screen.